A very warm welcome to you all to the Trust's Information and Support Morning. So my name is Jacqueline Ali. I'm one of the two heads of Information and Support at the Cystic Fibrosis Trust. And I'm really pleased to be here today with you, together with my job share partner, Becky Kilgariff, and several members of the Information and Support team at the Trust who are going to tell you all about some of the information and support services that we provide to people affected by cystic fibrosis. So this morning, we're going to be talking about our information library, about our support services, which include our helpline, our financial support and our welfare advice service, our youth programme for children and young adults with cystic fibrosis, and also some new events that we have coming up for adults with CF starting next week. We're also going to have a bit of a look ahead to a couple of events coming up in the next few weeks that you might like to be involved. So thanks very much to those of you who have submitted questions ahead of this morning's session. I think we'll be able to address quite a few of them as we go through the morning. We have had quite a few questions relating to subjects such as CF care and treatments and research, which are all obviously really important questions. But because we're going to be focusing this morning on information and support that we provide, we probably won't be able to address all of those in this session. So what I would recommend is that you have any questions that aren't answered through the course of the morning, then I would really encourage you to contact our helpline, who are very well placed to respond, and we'd be very happy to help. And we do have Matthew, our helpline manager, who's here this morning, and he's going to talk a little bit more about the helpline service. Also in May, just to highlight that we have the UK CF conference, and Becky's going to talk a little bit more about that at the end, but that's going to be a really good opportunity to hear about the latest in CF research and treatments. And also next week, we're going to release a video on our youth Instagram, which is about Kaftrio, in which our Director of Medical Affairs, Dr. Keith Brownlee, is going to be answering some questions that were put to us by the Youth Advisory Group and young people with CF. So before I hand over to the rest of the team, I just wanted to touch on a couple of things about how we provide information and support and how we approach that. I think one of the first things that I wanted to say is that we don't assume that because someone is living with cystic fibrosis that they need our support. And we know that some people are having their support needs fully met by their own support networks, and whether that's their families, their CF teams or others, and sometimes a combination of those things. But also there can be times where needs can arise unexpectedly. And obviously the pandemic over the last 12 months has been a prime example of that. And that's really dominated the information and support that we've been providing over the last 12 months as we've kind of adapted to those emerging needs. But there can also be certain events or periods in life where needs are naturally higher than at other times. You know, for example, when there's a diagnosis of cystic fibrosis, when a child is transitioning to adult care, when someone is considering lung transplant. And all of these things can lead to a number of practical and emotional needs and sometimes competing needs. And what we try and do is ensure that we have a really sort of comprehensive information in offering around all of these, a comprehensive information offering in place around these subjects. And then we provide further support where needed that is kind of tailored to the individual and takes into account that there may be multiple and competing needs and different factors at play. But what we hope from today is that you'll leave with a fuller understanding of the ways in which we can offer support and how to access that support if and when you do need it. So I just wanted to touch briefly on involvement and its importance. So some of you may have attended our CF Live event on involvement a couple of weeks ago, and that was all about the ways in which people with cystic fibrosis and their families can shape the Trust's work for people with CF. In information and support, input from people with CF and their families is hugely important because it helps us ensure that what we're offering is meeting your needs. And we're particularly keen to understand what unmet information and support needs you may have and how you feel they could best be addressed by us, but also things like how you'd prefer to access support and how also we can improve the support services that we currently offer. And this is hugely important, especially at the moment, given how much change there's been in the past 12 months, not only with the pandemic, but also with the arrival of Kaftrio. And both of these things have had really profound impacts on the lives of people with CF, often in very different ways, and have been experienced really differently, depending on people's individual circumstances. But what we want to do is make sure that we're responding in a timely manner to the evolving needs that people have around these issues and around other issues, and adapt our support offering accordingly. And your feedback really helps us do that. So we will be sharing a feedback questionnaire after this event, and if you have a few minutes to fill that in and let us know how we can best support you, that would be hugely appreciated. And of course, please do feel free to comment in the chat as we go along with any thoughts or suggestions you have. I'm now going to hand you over to Holly, our first speaker, and Holly is our information manager, and she's going to get us all started by telling you about our library of information resources. So thanks, Holly, and over to you.
First of all, what is our information? You might have seen it on our website, you might have been given it by your CF team, but we produce information. We have a library of over 100 resources, and we produce them for people with CF, produce them for their families, so parents of children with CF and other family members of people with CF. We produce resources for friends of people with CF and colleagues, and also importantly for CF clinicians, to kind of help support the level of care that people with CF get. We ensure that information is reliable and up to date, and it's stuff that people with CF have told us they need and their families have told us they need. The kinds of things we make really vary. I have to include that our information is award-winning. We've been recognised a number of times by the British Medical Association's Patient Information Awards. But the kinds of things we produce range from fact sheets to information packs. For many people, information packs are where they first see our information. So if you have had a child who's recently been diagnosed with CF, you might have our new diagnosis pack. That's often handed out by clinicians or found on our website. We also have videos, and we have a number of pages on our website that host our information as well. And then we also have consensus documents, which I'll talk about in a little bit, which are clinician-facing documents. But as you can see on the page, we've got you can see that we've got web content, physical packs, and then also digital content as well. When it comes to the kinds of topics we cover, we hope, and we are always trying to cover everything that might be important to people with CF and their families, and that's a big range of topics. And the way that we try to structure that is around life stages and making sure that we cover all the important life stages for people with CF and their families. So as you can see, from diagnosis, but then on to education and work planning, family planning for people with CF, transition from paediatric to adult care, and so on and so on. You can find all of our information, I'll go on to say this, but you can find all of our information at our website and just putting in /information or /publications, but you can also just Google it. It's Cystic Fibrosis Trust information, it should come up, and you'll get everything that we have to offer very easily there to download. How we make our information. So this is a representation of what the process looks like, and I'll explain, because obviously you can see there are a few repeated bits here, but it'll all make sense. So most importantly, before we create anything, we have to identify a need, and that's making sure that people with CF and their families need that resource. It's been identified, and also that clinicians have raised with us that that's an important need, and that we've spoken to the CF community about what that resource should look like. This is often through our community telling us what they need, or CF teams getting in touch, but we spend a lot of time listening at the very forefront before we've even considered what we're going to make. It's a matter of listening to hear what you need. Then it's on to listing again. Once we've decided that we do need a resource, we listen to the people who will be using it to find out what it should look like. So that might mean setting up involvement groups. We've done a few of these recently. If you're in our last one of these online events, we spoke a bit about involvement, and that for us can look like having meetings with parents or people with CF to talk through all the different ways a particular topic might affect them, and think about how we can incorporate that into our resources. Then it's on to creating the resources, which involves writing it either with clinicians or we write the resources ourselves as well, designing it and generally turning it into something that resembles the final product that you see when you find it on our website or order it from our helpline. We then go through a review. We'll share this first version, this creative version, with the people who started, who supported us at the very beginning, and find out again if it's something that they would like to use, that they feel feels relevant to them. We make sure that when it comes to involvement, people are involved across the entire production process. It's not just a case of listening at the beginning and then showing it at the end and going, hope you like it. It's really important for us to hear every step of the way, whether it works, whether it's fit for purpose. And if it doesn't, making changes and adapting and listening. We then take all that feedback on board and make the changes we need to do and finalise the resource. And then it goes on to designing the finished product. So sometimes we work with agencies, but we also have our own internal design team. It depends how big the project is. And then we share the resources. And this is where you might see them on our website, on social media, shared through some of our email newsletters, or appearing in your CF centre. We try to make sure that our resources are shared in as many different ways as possible, because we know there's not a typical way that people access us. We obviously hope that people will be really, really engaged and know where to find things, but we can't be sure of that. So we try to make sure that they're available in as many places as possible. And then finally, it's reviewing our resources, which we do every 3 years, but also when information changes. So obviously we have a big library. We spend a lot of time making sure that resources are up to date and fit for purpose. The ways you can find our information. So as I said, you can download it all download it or read it online. Some of our things are just web content at cysticfibrosis.org.uk/information. All of our resources, or the majority of our resources, sorry, I should say, can be ordered from our helpline. And you can find out more about that later today, but also by visiting cysticfibrosis.org.uk/helpline. And you can find what you need in our information resources catalogue, which I've included a little picture of there, but this is a catalogue that has everything in it that we currently produce. It's recently been updated for this year, so it has everything in it that you might need. But all of our most up-to-date information does sit on our website. And you can also ask about it at your CF centre. We work with a lot of CF clinicians, CF teams, and we try to make sure that they know all of the information we have and when it's updated. So hopefully your CF centre should know about some of our information, or have it actually at the centre. So, and I meant to say, and I haven't mentioned this yet, so just in case I don't go on to mention it, our consensus documents. So these are resources created for clinicians to set the standard for clinical care. So these guidelines are very big documents. They're primarily for clinicians, but they can also be really useful for people with CF to understand the care they should be getting and what a gold standard of care looks like. I think I do go on to speak about this, but on the off chance I haven't included it, I wanted to mention it. And those are really important resources, and actually some of the biggest resources we work on, but then not necessarily in our kind of patient people with CF kind of facing materials. So that's a good one to mention. So what's new? You might have seen our transition resources for young people and their families. Again, listened to people with CF and clinical teams, and heard that moving from paediatric to adult care can be a really big step, and also quite a challenging time for some families. So we felt it was really important to produce some resources that can offer kind of a standard support service for people with CF and their families when they have this transition. We know a lot of CF teams do it differently, so we wanted to offer a resource that anyone can access just by going to our website or speaking to our helpline. They include a young person's pack. So we worked with young people with CF on our youth advisory group, but also other young people who had got in contact with us, say they were interested in the topic. And they shared their experiences of transition and told us what they needed to sit in this pack. So as well as a booklet, which has lots of quotes from young people, the pack also has a number of activity sheets to fill out. So tips and ideas for a smooth transition, questions to ask your new and old CF teams, a transition checklist, things you should try and do before you move or after you've moved, and a template to fill in information about your adult CF team. We also produced a families and carers booklet. So again, in this case, we worked with parents of young people with CF who've been through the transition process to work on this booklet. And they provided fantastic quotes and feedback. And it hopefully goes without saying, we worked with these people throughout the entire process. So from the very beginning, speaking to them about what they needed, to the very end of showing them the final designs and making sure that these kind of resonated with them and felt relatable. The Parents and Carers booklet, sorry, the Families and Carers booklet covers when transition happens, why it needs to happen, the difference in care or the difference in style of care and responsibility, and things like building a new relationship with the CF team, and that changing relationship when young people move into adult care. When it comes to what's coming up, we, I'm on what's new. So what we also have, and you might have seen this, we have a fact sheet on emotional and social impacts of CAF-TRIO. So this is something that we this kind of area of need was flagged to us by our psychosocial team, which are a group of psychologists and social workers in CF who told us that this was information that was going to be really important as the rollout of CAF-TRIO began. So as you can see, it looks the ways people might be impacted by the rollout, including people who might not be eligible, but also people who are and have complex emotions around that. So that's available. These were shared just yesterday, so hopefully you might have seen these school class passes. They were developed for young people with CF to be used in secondary school if you need to be excused or move seat. So they kind of allow that to be able to be used without maybe drawing too much attention if you want to speak to the teacher. We have a new physiotherapy leaflet for babies and young children, so parents looking into airway clearance, which you'll be given by your physio if that is relevant to you. And we also have a new consensus document on physiotherapy, which covers the guidelines, our guidelines that outline the best practice in CF physiotherapy. When it comes to what's coming up, we are working on mental health and wellbeing resources to help support people with CF and their families. They're being produced with the support of a CF psychologist and members of the CF community who are sharing their experiences to help us develop something that really works for people with CF. We're also producing resources for young children with CF and their siblings. So we obviously have what's now quite an old video, Ollie and Nush, which has been really popular. And what we're hoping to do is create something new that's a little bit more up to date. And we're working with parents of children with CF and parents who have two children or multiple children so siblings as well, who don't have CF. And we're kind of at the stage of holding discussion groups and seeing what that will look like. We're producing easy read resources for people with learning disabilities. So these are kind of simple documents that explain what CF is, but in very easy to read terms, and use images. And we're hoping to work with, we've been speaking with MenCap, and we're hoping to also work with families who have children with CF who also have learning disabilities, and also people with learning disabilities themselves. And we have a number of new consensus documents coming out, one on psychosocial care, so that's psychology and social work, pregnancy, diabetes, and laboratory standards. So that's how samples are used in laboratories. How you can get involved. Obviously, Jacqueline mentioned involvement at the beginning, but you can contact our involvement team if any of these upcoming projects sound interesting to you, or you want to be in the loop about things that are going on in the future. And if you have any suggestions for how we can improve our information, you can get in touch with the information team. That's something that I'll be answering those emails if you want to get in touch with any kind of ideas you have or questions. I've included a couple of quotes here from parents and people with CF on our resources. I think at the end of the day, it's most important to us that these resources are available to people when they need them most, and that they in some cases we're really pleased to see they kind of offer people support that they didn't have previously, and allow them to kind of find out more about what we offer. So these are a couple of quotes that I thought were really nice, that we were really pleased to see that we're helping to support people through our information resources. And that is it from me. I will stop sharing my screen.
Thanks very much, Holly. That was really great. It's a really useful overview. I can see there's been a few links posted in the chat to some of those resources, so please do have a look through those. And like Holly said, do let us know your feedback and thoughts on our information and whether there's any other information resources that you'd like to see. So I'm now going to hand over to Becky and the support team, and they're going to take you through some of our support services.
My name's Becky. I work alongside Jacqueline as the other Head of Information Support and Programmes at the Trust. And I'm going to talk to you a little bit about our support services and introduce you to the team that deliver them. So in terms of our support services, I think one of the things that we're really keen to get across is that we are a small, friendly team. We're definitely not a call centre. We know, if you hear words sometimes like helpline and support team, you might picture a big call centre, but we're really not. We're quite a small team. We all work really closely with each other. Obviously, we're all working from home now, but actually we have quite a long history of working from home in our team anyway. So I hope that knowing that encourages you to feel that we're very approachable. We're here for you. I think, as Jacqueline kind of alluded to earlier, we know having CF or being affected by CF doesn't automatically mean you have needs or that you need us. In fact, we would rather you didn't, and that you didn't need any support and everything was fine for you. But if you need us for whatever you need us for, we are here. We try to offer a really personalized service. So for us, that's about not what we want to deliver for you, but understanding what you as an individual need, and then tailoring what we do to that. We try to be really holistic in the way we work. So this is about linking in with everything we do through our information provision. So we have, as you've seen, amazing information resources on, all sorts of topics to do with cystic fibrosis. And we can provide the support to back those up. You can obviously access the information, but if you need to talk something through, we're here for that. We also try to make it really, really seamless for you, that if you come to us about one thing, but we can support you in another way, that's just really easy for you to access. And you'll see from when the team talk, one of the really key areas that people contact about is financial issues, in particular benefits. So we're really conscious that if you come to us with a benefits issue, you probably do need to talk about it a bit. It's a difficult subject and it's often upsetting for people. So our helpline team are here for that. And then we have practical support through our benefits advice and immediate financial support through our grants, and the team will talk a bit more about that. Everything we do is individual to you. Some people might need more support at certain points than others. We try and tailor what we're doing and the way we deliver it to you. And most of all, we try to be empowering for you. So we're trying to make sure that you have the support to tackle any challenges or barriers that cystic fibrosis brings for you. I'm going to introduce you to the rest of the team. So like I say, we are a really small team, and if you call us, these are likely to be some of the people that you would speak to if you contacted us for support. So I shall stop sharing and I shall hand over to Matthew, who's our helpline manager.
I'm the helpline manager at the Trust, and it's really good to be with you all here this morning. So I'm going to talk to you a little bit about the work of the helpline, how we can support you, and how you're able to reach us. So how we can help you. So we are here to provide information about any aspect of cystic fibrosis. We're here to offer a listening ear. So as Becky said, our support is very holistic in the way that we approach things. We understand that things can get really tough, and our friendly team are here to talk it through with you. We can help you translate and help to understand any overwhelming or complex information. So I think that's particularly relevant at the moment with the pandemic and everything we're going through with COVID. Often there's ever-changing guidance, which can be quite hard to dissect, and we're here to help you through that and help you understand that information. We can also signpost to help and assistance available through other areas in the Trust, other charitable organisations that may be able to support you, and other avenues of support which may be appropriate as well. And finally, we can provide information and guidance regarding other support and programmes run here at the Trust, including welfare and grant support. And I'm just going to talk a little bit more about that. with you now. So generally the helpline acts as a gateway to other support services in the trust, just building on what Becky said, often using the example that Becky used of benefits, often it can be quite an emotional thing to talk about. So we're there to talk it through, make sense of things, and then we can work with you to arrange some practical support for you. So that may be through our welfare grant service, which Katy will be talking to you a little bit about, our welfare and benefits advice service, which Sangeeta will be talking to you about, income maximisation, which is Nicky's area, or perhaps our CF Connect service, which is a peer support service for parents. So I'll hand over to my colleagues in a moment to talk a little bit about their areas, but generally to access these services, you can go to the website or you can come through to the helpline and we can help you, refer you to those services to be able to get those specific areas of support. So who we're here for? We're here for those living with cystic fibrosis. We're here for family, friends and relatives of those living with cystic fibrosis, teachers, employers and other professionals. So quite often we do get contact from, for example, a teacher who's got a child with cystic fibrosis in their class, just wanting to know how best to support them, find out a little bit more about cystic fibrosis so that they're in the best possible position to be able to help that child. Anyone affected by cystic fibrosis, and indeed anyone who has specific questions about CF or just generally wants to know a little bit more about the condition. So we often get contact from friends of families, so that they may have a friend who's recently had a child and they want to know a little bit more about the condition so that they can support their friend and their friend's son or daughter, so that they can be in the best possible position to be able to do that. And we can talk to anybody that wants to know more about CF, tell them, guide them to our information resources that Holly talked to you a little bit about earlier, and provide any kind of support that you need to understand CF more or get some support with that. In terms of how you can reach us, so there's three main ways that you can reach our helpline. First is by phone. So you can call either one of the two numbers that you'll see on screen there, and you'll be connected with one of the helpline team. As Becky mentioned, we are a really small team, so if we're ever unavailable, you can leave a voicemail and we will get back to you. We will give you a call back. The second way is via email, so you can just email helpline@cysticfibrosis.org.uk, and we'll get back to you within 3 working days. Generally in practice, we do get back to people a little bit quicker than that. It's usually within a day or two, but at the most it'll be 3 working days. And if at times we may need to refer to other colleagues to find out a little bit more or get some more information to give you as full an answer as possible, we may send a response just to say, we're finding out a little bit more about this, and we'll get back to you when we have a complete answer for you. And finally, you may have seen that we do get back to people in, for instance, the comments section when we've posted about something. So if we've posted a COVID-19 update, for instance, which may be a change to guidance or a shielding update, you may see that generally we do get back to people in the comments there. Where there's generally a lot of questions when a new piece of guidance has been introduced, or you don't have to kind of reactively comment on a post in order to get in touch with the helpline team on social media. We understand that for a lot of people, social media is their way of connecting with organisations and services these days. So you can send us a message or send us a DM on our social media channels, and we will get back to you. The additional thing is that also, if you send us a message, it's more private as well, so you don't have to comment in an entirely public setting to connect with us on social media. So to find out more, just a very small plug from the helpline team. We will be featured in the next edition of CF Life, and just adding to what Becky said earlier, I think if you do have a look at that piece in the spring edition of CF Life, you will see how small the helpline team really is. So we'll be sharing it's a day in the life piece, so we'll be sharing about how we approach the working day, and also how we unwind and what we do outside of our helpline work as well. So do take a look at that if you get the time to do so. And also do get in touch. So if you have a question or you'd prefer to ask something privately to us about the work of the helpline, you really are welcome to email me. You can send this to the usual helpline email address, and I'll make sure that I do get back to you. So if you wanted to find out any more, or you just wanted to have a chat with me about how the helpline team can support you in more detail, then please do get in touch. I'm more than happy to have a chat with you and tell you a little bit more about what we can do to support you. Thank you for listening to the work about the helpline. I'm going to hand over to Sangeeta now, who's our welfare and rights advisor at the Trust, and she's going to talk a little bit about how her service can help you.
Thank you, Matthew. That was really useful, and it's really important for me to say that I work really closely with the helpline, and they're absolutely key in delivering key benefits information. So I'm just going to tell you a little bit about what I can do to help, what I can help with, and how I can help you. So mainly I give advice and support on claiming benefits. That can be about any stage of the benefits process. So it could be about applying for a benefit. It could be about checking whether in fact you'd be better off applying for a different benefit, or it could be about challenging a decision right through from the initial decision up to tribunal and sometimes beyond. I can provide a supporting letter. So based on the information that you've given me and told me, I can provide a letter to support your claim for personal independence payment or perhaps disability living allowance based on what you've told me. I also can provide some general advice and support on issues such as employment rights and housing rights. Mainly this would be about discrimination aspects, so disability discrimination, if you feel that you have been discriminated against. And normally in that situation, because I'm not a specialist, I'd be signposting you to further advice and support. As Becky mentioned, you'd be given advice and support that is individual to your situation. So I'd be tailoring my support to you and empowering you to do as much as you need to do. And that's the approach that we take. So I hope you find that if you approach us, that we will go through with you what you want to achieve and how to achieve it and how much involvement you need and how much support you need from us. The best way to access the Welfare and Rights Service is by contacting the helpline through all the ways that Matthew said, and then you will be referred on to me. And the way that I would help you is through a telephone appointment session, which sometimes can be up to an hour, because it's important for me to understand a little bit about you and your background, and obviously to go through some quite complicated and technical forms. But I am here for you. So I hope you find that the service is something that you can access quite easily. Other things that I do provide are training and support for CF teams. So you might find that I can work closely with your social worker. You might find that your social worker suggests that you contact me for specialist advice on a subject, which maybe they can't give you an answer for. And also I work closely with our policy team, which is at the CF Trust. And if there is something that is affecting a lot of people, something that's going wrong, then if you let me know or you let the helpline know, then we all work together, and I'd be sure to let the policy team know about a welfare benefits issue that's affecting a lot of you. So that's me finished, and I believe that it's straight over to Nicky next.
Hi, thanks Sangeeta, and thanks guys for having me. My name's Nicky. I've been with the Trust for 14 months as a welfare officer and provide income maximisation support to people and families living with cystic fibrosis. Our income maximisation service can support people to access our welfare and rights advisor, the amazing Sangeeta, as well as check people are getting all the financial assistance they're entitled and helping people to make the most out of their money. The income maximisation service offers individual support to talk through your household circumstances. We consider together all the options available to increase your income, such as benefits, tax allowances and discretionary payments. and look at making money go further by finding savings and discounts where possible. We offer support to people with CF who are entering higher education, looking at benefit options, budgeting, and support with disabled students allowance. We also explore national insurance contributions and credits as well when considering the qualifying years needed for a state pension. There are heaps of different tools, budgeting and income options that even the most savvy of us are missing out on. Regardless of your situation, it's always worth a check just to make sure that you're getting the most and making your money go further. You can check out the financial support pages on our website that contain useful resources to help at different life stages. And as Matthew mentioned, for an income maximisation appointment, you can contact the helpline. Short and sweet from me. I think it's over to Katy now to talk about the grants.
So yeah, I'm Katy. I'm the Welfare Grants Officer. So if you do email grants, then it'll be me who's responding to you. Just to start off with, so a quick overview of what we've got. We've got 8 types of grants to help balance fibrosis and their families through challenging times. I'm going to go through 2 in a bit more detail. The idea of the grants, it's like along with Sangeeta and Nicky and the helpline, is at supporting long-term health and also in short-time crises. And just to say that all the applications that we get need to be supported by a member of the CF team, just so that the CF team are aware that there's something going on that might affect your health. Our grants are paid directly into the bank accounts of parents or people who apply. So again, it's empowering people to, have that money directly to use as they want to. And that it's confidential along with the rest of our service. So no one outside of our support service team would know that you had a grant unless you decided to tell them. Just so you know, so that's the full range of the grants and the web link at the top, which I know is going to get shared into the chat. And just going to talk a little bit about our emergency grants, first of all. So these are our £150 grants that can help with daily living costs. So that might be food costs or travel costs in situations where you've got an immediate financial difficulty that might be affecting your health. So that could be there's been a benefit reassessment and you're not receiving PIP, or someone's had a job redundancy in the family, or more recently in the pandemic, you've been on furlough, having reduced costs, and that's making it a bit more difficult to get the food in that you need to stay healthy. Other quite usual applications we might get might be an unplanned hospital admission. So there's additional parking costs, food costs, if the food you get in the hospital isn't something you, or perhaps your child is happy eating. And also essential household items. So that might be if the fridge is broken and you need that to store your medication. We can also do that as an emergency grant. And we can also be a bit more flexible with the amount of money we give for those white goods when we know that it might not be that reasonable to be able to afford that with £150. And because they're emergency grants, we're quite responsive on those. We normally try and get back to people, the same day or the following day to let them know we received the application and pay that the following week, or possibly the week after, but in general the following week. I've got a case study here. So this family gave consent to be a case study. So a woman with CF who has 2 young children who applied for a grant to cover petrol and food costs, so that's daily living costs. And the reason was that she was recovering from surgery, which meant that she needed to pay a little bit extra for childcare, was impacting on her general income, which was already a bit inconsistent because of furlough. So her husband had been on furlough, returned to work, which was affecting their benefits, which meant that was fluctuating. So the £150 emergency grant helped pay for the daily essentials while she recovered, and it was her nurse who provided the supporting statement in that instance. So just to say, it could be anyone from your CF team who could provide that statement: social worker, consultant, dietitian, physio, whoever is really available, or perhaps your psychologist. So moving on to our health and wellbeing grants, which are for more longer term health and wellbeing. So again, we do often give these grants for household items. I've put there just the kind of general amounts that we will give. This is normally the maximum that we can give for these different items. Well, all this information is on our website. I've just taken that straight from the website. So yeah, things like fridges, freezers, or fridge freezer, and I'm going to show you a little example of someone we gave a freezer to actually next. And also home exercise equipment. So obviously during the pandemic, gyms aren't open and people feel much safer exercising at home, and we recognise that. So we've seen a lot of applications for things like exercise bikes or trampolines for children
children things like treadmills or get weights and things like that. For things like treadmills, which are a bit more expensive than £200, we just need to know that someone is able to cover that difference in cost. But then we'd be happy to sort of give a £200 grant if we think that that's appropriate. And these grants are assessed at a panel every 2 months. So the panel's made up of 4 members who've got a connection to CF. So one person is a person who has CF, someone who was once a social worker, and 2 others with family connections with CF. And so they'll look at all the ASDAP applications and make their decisions. And just to say that the next panel is in mid-May. We haven't got a date yet, but that'll be up on the website shortly within the next couple of weeks. So a little case study for you is a family who have a 4-year-old son with CF had applied for health and wellbeing grant for a freezer, so they could provide nutritional food for their son in a way that was affordable, easier to bulk cook and store it in the freezer. And the reason they'd applied for the grant was that Dad had lost a job during the pandemic, and so it was a bit more difficult for them to afford this themselves. So we gave the £170 grant, which is our standard amount, and that meant they were able to buy a freezer. And so how do you actually apply? So you could speak to your CF team, first of all, to kind of check in with them, let them know what's going on. They might suggest you apply for the grant. They might be happy to fill out the whole grant application form, which is just a Word document, and send it across to us themselves, or they might suggest that you fill out your part and they'll provide a supporting statement once they've seen what you've written. If you find it a bit more difficult to contact your CF team yourself, you could contact the helpline first of all and see what they suggest. Our helpline can also help you fill out the application form if you don't have an ability to fill out a Word document on a computer. Obviously, during the pandemic, it's a bit harder for people to print, and we are totally happy for that all to be filled out on the computer and emailed across to us, or to call a helpline, and one of our friendly helpline staff will fill it out for you and just send it across and let you know what they've written. And just to say, you can apply anytime. So our emergency grants, we process them twice a week, and our health and wellbeing grants, though they're processed every 2 months, apply anytime. If it seems like it's more urgent, or there might be some flexibility depending on the situation. So don't feel like you must wait 2 months to see when the next panel is. And just briefly to say, we normally process about 1,000 grants a year. This year so far, we're probably going to do about 1,500 grants. We processed quite a lot during the first lockdown, and that the average grant amount is £200. So just to give you a little bit of an idea of what our grants kind of tend to be. Because we have done so many grants this year, we've actually supported, we think, about 1 in 10 of the population with CF. So that's quite a nice stat for you. And I think that's all. I just got a little couple of quotes here so you can see how people found the process. Thank you, and I think it's back to Becky.
Brilliant, thank you very much. So I hope that gave you an opportunity to meet some of the team who directly work on the front line of our support services. I'm aware there's a couple of questions in the chat, so I'm going to pick those up. I think I just wanted to just pick up on a couple of things that Katy mentioned as well. So the impact of COVID on the cystic fibrosis community has obviously been enormous, and the team have really been on the front line supporting people through that. And Katy gave you some of the stats around the grants. So by the end of the year, so for us, that's halfway through our financial year, we'd already provided pretty much as many grants as we had in the full year before. Katy gave you the stat of that we think this year we will have directly supported around 1 in 10 people with CF with a grant. And the helpline, they've taken 1,000 extra inquiries so far this year, which is around a third more than normal. So we would normally take around 3,000 inquiries a year. So far we've taken around 4,000, with the peaks of those being when times were really uncertain, in particular sort of right at the beginning of the pandemic when shielding was first introduced. So I will just pay tribute to the amazing information and support team and how much they have done. And they really are a bank of knowledge about COVID and about what's going on. So if you do have questions, if something's worrying you, please don't hesitate to speak to the helpline, because the chances are we will have come across it, or we may know. I think we have quite a large knowledge of government guidance, however regularly it changes, and how it relates to CF. And we've tried to see our role at the Trust as really translating what that government guidance means for people with CF, and issuing updates on that. So I hope that has been useful for people. Just want to pick up on something else that Katy mentioned, which was about confidentiality. So within the support service, everything that we do through the helpline, through our benefits advice, is completely confidential. It's shared only within our small team, and not even within the Trust more broadly. The bar that we set ourselves is that we know we have colleagues who have CF, we have colleagues who have family members with CF, and we need them to know that they could contact us completely in confidence. So that means that anybody can. So even if you are, a really regular contactor of the Trust, and you work with us in lots of other ways, the fact that if you've needed to contact us about your benefits or anything will be completely confidential within our team. What you might find that means is that if you email the helpline about fundraising, we will not even be able to forward your email on without your permission. So we'll come back to you and say this service is confidential and we need your permission to forward on. And that's because we hold that standard of confidentiality really strongly, because it's really important to us. So just before I share my last slide, I'll just pick up on a couple of questions. There was a question in the chat to ask whether cystic fibrosis is considered a learning disability. So we wouldn't consider it a learning disability as such, but we know that actually there are plenty of people with cystic fibrosis who might also have a learning disability, and that for some families those two things interact and might lead to different or particular support needs, and that's something we're really interested in ensuring that we are supporting effectively. So for anyone who that's your experience, if you want to share that with us at any point to support us in making sure that our services and resources meet everybody's needs, we'd be really interested to hear from you. Another question was whether the grants are means tested to see who's eligible. So we don't means test specifically, and the key reason why we don't sort of have a standard means testing is because CF has a tendency to throw people curveballs, and the pandemic has been a really good example of that, that even if you are perhaps earning comfortably day to day, something can come out of the blue, an admission or suddenly something like shielding that means that it wouldn't be appropriate to be looking at your household income as a way of assessing whether you're eligible. But we do ask for quite a lot of information on the application forms to help us identify those in most need. So we, through our emergency grants, we're often funding basic daily essentials. So we are generally hearing from people who are struggling to afford the basics day to day, perhaps in a particular financial crisis. We don't meet ongoing costs. So if it's an ongoing situation, then we'd be looking for a different way to support somebody through Nicky's income maximisation work and Sangeeta's benefits work. But we don't specifically means test, but we do ask questions to understand why that grant is needed. We also then have more questions for the health and wellbeing panel, which supports the panel to make the decisions. The panel have to make really tricky decisions because we don't have enough money to fund everybody who applies for a grant, and that can be really, really difficult. So we try to target it at where there is most need, and also we look for the relationship between the grant that we provide and directly improving someone's CF health. And also, understanding why it's something that they perhaps couldn't afford themselves. We then collect anonymized data to look at who we are supporting through the grant program, and we know a very, very significant majority of people we support have a below average household income, and a good proportion have household incomes below £15,000 a year. So while we don't means test, we do check that we're reaching the people in most need through the data, and so far it bears out that we are. So I hope that helps to answer that question. You'll see there's slightly different questions on the application forms depending on what sort of grant you're applying for. I'm just going to share my screen with you all again, just to briefly talk through our future plans. So thinking about our future plans for the support service, we have some really exciting plans about developing the helpline. Matthew, who you heard from, joined us relatively recently in October and has done an amazing job of moving the helpline into social media, so us being more available on social media to answer your queries. And our idea with that is that we want to meet people where they are. We want to make it as easy as possible for people to contact us if they have a question. So we'd like to do more with that. We'd like to think about things like chat apps, things like WhatsApp that everybody's using day to day on their phone, and that would make it as easy as possible for you to get in touch with us. We will need additional funding to enable us to do that, so we're putting together a project that we'll be applying for funding for to help us develop our helpline. But in the meantime, we continue to develop the social media side of it, so hopefully that gives you an easier way to contact us if you're not a phone or email person. We're also hoping to move forward a project around understanding the needs and experiences of people with CF from Black and minority ethnic backgrounds. It's something we started last year, and we aim to do some consultation work in centres, but unfortunately COVID got in the way because we were hoping to go out in person and talk to people and families and understand any particular challenges, and also how that then translated into the information and support we need to provide. So we hope to move that forward in the year ahead. One of the things that's really key for us now is navigating a changing landscape of cystic fibrosis, whatever that means for you, and it does mean different things to different people. You know, we know some people will be on new treatments and will be experiencing changing health from that. Others won't, or won't be able to access those. However we look at it, the landscape of cystic fibrosis around us all is changing. And we also know that when you have to navigate those changes, you're going to be navigating them in what we hope will be a post-COVID world, not a continuing COVID world. And that is really something that's at the top of our minds at the moment, is how do we make sure that the whole of the cystic fibrosis community has the support you need to deal with all of these changes, because change, even if it's positive, can be challenging for us. So even if a change in your health is positive for you, you can have mixed emotions around that, and you might have new practical challenges. If you're not eligible for new medication, you might have particular concerns or challenges that you'll need support with. So some of the key things we're thinking about is how we can support people with their mental health, how we all navigate and recover from the pandemic together, because whenever the day comes when we don't know what that sort of endpoint marker will be, but moving towards perhaps shielding ending again for adults with CF, perhaps a return to normality slightly more for children with CF. I think we're very aware that we won't all wake up one morning and be exactly as we were before. We are all going to need support to get through it, and the CF community, having been so deeply affected by the pandemic in so many ways, will need more support. We're also thinking about sustainable financial futures. So you've seen the financial support that we provide, but we think there's probably more we could do to, particularly for people whose health might change, or for people whose health doesn't change in the near future, to make sure that you have the tools you need for future financial planning, whatever that means for you, that you can access any relevant schemes around employment, and something we haven't yet mentioned is our Helen Bright Ideas Awards, which supports people with their business ideas, so supports adults with CF with their business ideas, because we know that self-employment for some people is really positive in the way that it works around cystic fibrosis. Although all of this means change, I know from speaking to my team who you've heard from today that they're in no way daunted by this. We'll continue to provide the support that you need as individuals. We're here to listen to you and understand what you need, and then provide that support or empower you to access it. So it's not really about what we think people might need. It's about what you need. And coming on to that, we need to know from you, we need your input. So if you want to share with us the things that you think you might need support with in the year ahead, or that beyond that, we're here to listen at any point. You know, we don't need to launch a consultation for you to tell us. You can tell us at any point. If you think something is missing from our support, please tell us. If there's something we could be doing different or better, please tell us. All of the team is absolutely dedicated to providing the information and support that you need. So please tell us. That's almost it for me. I just realized that I didn't fully expand on the question about disability, and I'm not sure that I answered it. So in terms of learning disability, please do contact us if that's something that you want to share your experiences of. In terms of disability more broadly, it can be quite a difficult word. I think many people with CF don't necessarily recognise or sort of associate themselves with being disabled or having a disability, and others do. The reason we use it as an organisation is because it's important for your rights. Under the definition of a disability in the Equality Act, we would class that most people with cystic fibrosis would fall under that definition. And that means that you do have rights and protections, particularly in employment. So for us, it's an important word to use when we are talking about your rights, but we also recognise that it's not always a word that people with CF use or feel comfortable using. But I hope it's clear that where we use it, it's about your rights and that definition under the Equality Act, and us ensuring we do our job in empowering you to access your rights. That is it from me, and I will just stop sharing my screen so that I can check the chat and make sure I haven't missed anything. Great. So we're going to head to a short break. So you can probably take 15 minutes. So we'll come back at 11:20 if that's okay with everybody. So, oh yeah, 11:20. So time to, I hope, get a cup of tea and join us back here where we'll be filling you in on more of what the team does. Thank you, everybody. Welcome back. I hope everybody has feeling refreshed and got a cup of tea or whatever it is that cheers up your mornings. I'm now going to hand over to Ellie, who is our Youth Programme Manager.
So I'm going to be talking about our youth programme and how we connect children with CF online. The youth programme is split into two parts, really. We've got BBF, which, well, Building Brighter Futures, BBF for short, and YAG, which is the Youth Advisory Group. So I'm going to be kind of running through both of those things for you today. So Building Brighter Futures is a programme of online workshops, events and resources for children. It's funded by Children in Need, and it's open to children with cystic fibrosis and their siblings between the ages of 6 and 18. The online workshops and events take many different forms. I'm going to be talking to you a bit about what we do in the next slide. But we have one-off events and 6-week workshops. So really, we kind of cater to children, however involved they want to be. They can come to one event every few months, or they could come to everything. They could come every week and then do kind of 6-week long courses at the same time as well. Our aims of BBF, or Building Brighter Futures, are to increase children's confidence, help children develop skills to manage their cystic fibrosis, and give children the opportunity to form friendships and build social networks. And we really try to do that in a fun environment, a fun and safe environment, to kind of bring them together and build these skills. And we do that through things like the Games Night. Our Games Night is one of our most popular events, and we do this quite regularly because there's such a competitive wait list for it. And so we play games like Among Us and Fortnite, and these are co-facilitated by a young adult with CF himself. And yeah, these are extremely popular. They always they're free, but they always sell out. And yeah, we just kind of try and put as many of those on as possible because children seem to really love it. We also do regular yoga and dance sessions led by Nicole, who is another young adult with CF. And yeah, that's for 6 to 25-year-olds. Oh yeah, so Nick, sorry, we'll be talking about the kind of adult events a bit later, but yeah, so ours are 6 to 18-year-olds now. We have regular movie nights. Last night we watched Over the Moon, which was a bit of a crazy film. Lots of weird animals, but yeah, the children seem to love it. And kind of we do it on teleparty, so we're all watching the film at the same time, and there's a chat stream, so we're talking about the film, what's going on in people's lives, and just being a bit silly. In the autumn we ran some comedy workshops, a 6-week course of comedy workshops, which was really nice, really fun, getting children together to be a bit silly, make friends, and kind of exercise their imaginative, creative skills. We've also done things like socials. In Halloween, we had 17 children dressing up in their scary costumes and coming to play Halloweeny games. We're running a 6-week coding workshop at the moment. We've just had our 2nd week of that. We had creative writing in the summer, so we really try and put things on that are a real range of activities for children. So they don't have to be active, they don't have to be still. It's kind of whatever, trying to be fun in loads of different ways. And we've got things like arts and crafts, juggling, and things like that coming up. From feedback, we're seeing that people really value kind of our events, especially at the moment during these kind of difficult times. People are saying lots of things about how they're building their children's confidence and giving them something to look forward to and something to kind of bring them together with friends and have fun when things are a bit difficult at the moment. I've got a few quotes. I'm going to read these out just in case people can't be bothered to read or can't see the screen for some reason. So, my son has looked forward to doing these every week. I really do think your youth programme is brilliant and a great opportunity for children to have some fun, make relationships and share experiences, especially when CF can be so isolating. Another one. I'd like to say a huge thank you to Bahar, Ella and the CF Trust for the creative writing course that my son attended. He really enjoyed the course and I've never seen him as enthusiastic about writing. Ella really captured his attention, which really is a big thing, especially at the moment. The weekly sessions were fantastic and gave him something to look forward to at such an unusual time. And then this is from a child who took part. I loved this workshop and I can't wait for the next one. I had a great time, but I do not want to change anything because it is the best workshop I have been to. Thank you to the people who made this workshop happen. And then something on Facebook, I think it was. My son played last night as well. He loved it and was so happy to have made a friend just like him. So this is something we're seeing a lot of in the feedback, is children that are really excited to meet people and meet other people that have CF. And it's not that they necessarily talk about their CF much. They talk about loads of things, but just having that connection and that kind of thing in common has been something that we see fed back to us. I'm going to talk a bit about YAG, the Youth Advisory Group now. And this is an advisory group for young people with cystic fibrosis and their siblings between the ages of 14 and 25. The way it works is we've got 2 groups. We have a wider group, which it doesn't require so much commitment. Basically what happens is I email out opportunities as and when they come up. So this could be things like feeding back on a patient leaflet, contributing to creating some of our resources, getting involved with an external opportunity with a researcher, or writing an article for CF Life. And the young people can really choose what they'd get involved with depending on their availability, depending on their health, depending on what they're interested in. We then have a core group, which is slightly smaller, and they meet every month and lead their own campaigns and projects. And I'm going to be talking a bit about a couple of their projects coming up. And the aim of this group is to get young voices heard and to influence work at the Trust. One of our recent projects was called More Than CF, and this was a campaign on the youth Instagram account. This was in the summer of 2020, and the Youth Advisory Group felt that they really wanted to have a bit of a celebration, put something positive out there. they kind of felt a bit sick of being labelled as a vulnerable group. They wanted to show that young people with CF are more than their CF. And so they did this through encouraging young people and children to share things that they were proud of. And so, as you can see here, this is an animation from a young girl, and she had lots of fantastic animations that we shared. If you'd like to see them, then we'd love you to go to our Instagram account. You can see it there next to it, CF Trust Youth, if you have an Instagram account. We had loads of things. So this is an animation example. This is a painting that someone had done. It wasn't just art, it was things like sports achievements, degrees people had done, saying they were proud of that, and making dream catchers, baking. It was amazing to see the real cross-section of skills and talents in the young CF community. Another recent project was our Youth CAF Trio survey. Towards the end of the summer, kind of September time, YAG identified that they felt that as a result of the CAF Trio news, there was a bit of a divide in the community, with people not really knowing maybe how to express their emotions, or maybe feeling guilty about some of their emotions. And they wanted to offer a platform to young people to express themselves and to say, you know, all of your emotions, all of your feelings are valid. It doesn't matter what you're feeling, that's okay. And they decided to do that through a survey. And we put together a survey, and we checked it with some CF psychologists before we put it out there, and then released a snapshot of the results onto the Youth Instagram recently. So some kind of more quantitative things like this, and then a snapshot into kind of some of the things that people had to say. And again, if you do want to have a look at this, please do go to our CF Trust Youth Instagram. There are a few questions that came up as a result in the survey, and we will be answering those questions on the Instagram account over the next week or so. Yes, safeguarding, just for the whole youth program, of course, safeguarding is so important, and we take it really, really seriously at the Trust. All our staff are trained in basic safeguarding. At every youth program event, there is a designated safeguarding officer on call. And so this is someone who has a bit more experience in child safeguarding, and who has done extras training with the NSPCC. And so they're just there to make sure that if there's any issues, they're there to kind of handle them and to make sure that the staff know what to do as a result. All our events are thoroughly risk assessed, and we have clear procedures in place for any problems. And that means that every platform we use is individually risk assessed. So we've got a Teams risk assessment, a teleparty risk assessments for the games nights, just so we know that every platform we're using, we know exactly what we're doing and exactly how we are going to safeguard the children that participate. There will always be 2 responsible adults at every event. No adult will ever be alone with children, and at least one of those will be a Trust staff member who is DBS checked. And DBS checking, for those of you who don't know, is a kind of police background check. Yeah, so in terms of what we have coming up, we have juggling for 6 to 12-year-olds this Wednesday. Arts and crafts for 6 to 14-year-olds on Tuesday the 16th of March, and that will be split into 2 groups, a younger and an older. And then yoga and dance for 6 to 15-year-olds on the 27th of March, which again will be split into a younger and older group. And if you do want to sign up, or have children that want to sign up, or know any children, please do. We'd love to hear from you, and we'd love to answer any questions you have as well. And the email address is there, cfyouth@cysticfibrosis.org.uk. Thank you very much. I hope that was interesting and helpful for everybody.
I'm just going to just give you all a little bit of information about some further events that we've got coming up in the next few weeks. Just before I do, after that, we're going to come towards the kind of closing of the event. So if you do have any questions that you want us to answer about anything that you've heard today, do pop them in the chat now while I'm talking, and I'll try and pick up on them before we finish. We're really excited that this week we're going to start some pilot online events for adults who have cystic fibrosis. As you've heard, we have a really well-established youth program, which is delivering amazing things. And one of the questions we've always had is why are we not able to deliver the same events for adults? And the basic answer is because we have specific funding for children and young people, not because we feel it's any less important to deliver them for adults. But given where we are, we're still officially with adults with CF under shielding advice. We've tried to put in some pilot events for the next few weeks to see how they go. So we're starting on Monday with a dancercise event with Nicole, and there are still a few spaces on that if you want to book. You'll see the booking links there. If you go to the website and go under Get Involved, you'll see activities for adults. Then on Wednesday, we have restorative yoga with Nicole, which is actually sold out at the moment, fully booked. And we're just about to start advertising 2 further events delivered by CF physios. So we've got Pilates and then HIIT training. So we hope in there's a mixture of different things that people will enjoy, and also aimed at different exercise levels. Really, these are pilots, so we're hoping people do sign up to them and that they're popular, and then that we can evaluate how useful they are for people. Because if we want to do more of this sort of thing, we have to bring in funding to enable us to do it. And the way you bring in funding is by clearly demonstrating that and evidencing that there's a need and that this helps people. So we really hope that these are popular, and please do, if these appeal to you, book on there for anyone aged 18 and over who has CF. A few more things that we have possibly in the pipeline, but really we need to hear from you what would be useful. We've been thinking quite a lot about things like well-being, mental health, mindfulness, both for adults with CF, obviously through the youth program we support children with CF, but also for parents as well. Particularly kind of considering the quite stressful time, to probably make an understatement, that the past year has been for everybody. So I think we're keen to know whether that would be something that would be useful for people. For adults with CF, we're thinking about something, we've obviously got the activity events, but perhaps something a bit more social and a bit more fun, like a quiz night or a gaming night. But again, we want to hear from you as to what you'd like us to put on. And for parents, one of the things that has come out of some recent research that we've seen is that parents are concerned about about their children's emotional well-being at the moment and how they support them with that. So we're looking at whether we can put on an event to help parents support their children with any worries that they might have. Some of you might have joined some of our CF live events. So during the pandemic, we've been running sort of regular online events through Zoom, very similar to this, with a particular topic. So we recently had a really successful CF live on involvement. We've done them on things like employment and financial support through the pandemic, on the return to school when schools started to reopen in the August term, and that series will return later in the spring. Other events that are coming up, as has already been mentioned, we have the UK Cystic Fibrosis Conference, which is obviously usually an in-person event, which we also stream online so that people with CF can access that. But this year it will be understandably a fully online event on the 12th of May. So the core audience is obviously researchers and professionals, but it will be open access for the CF community. And that's a really good opportunity to hear in quite some scientific detail, I can say, having attended past conferences, the research that's happening and treatment developments. Finally, every year we have CF Week. So here are the dates for CF Week this year, 14th to 20th of June, and Wear Yellow Day on the 18th of June. Hopefully yellow will still be in fashion, so that it's really easy to find yellow things to wear. Okay, I'm going to stop sharing my screen and just check whether there are any questions I need to pick up in the chat. Okay, whether the yoga session will be repeated. I hope so. As I say, we need to think about how we fund those events going forward. but it's really great that it booked up so quickly. So I very much hope that we can do that again. And Nicole, who delivers it, is a fitness professional who has CF herself. So I think she's really keen that we can deliver it again. Siblings events. So often we do have siblings join the youth events, so they're very welcome. I think one of the things that we're thinking about more broadly is information and support for siblings, addressing that on a broader level, because I think, as has been said in the question, it's about sometimes supporting those children to understand what their sibling needs to do as part of CF. So I don't think we have any specific events that cover that as yet, but we certainly have events that siblings can join so that they can perhaps be in contact with other children with CF. We also have some quite useful resources. The Ollie and Nush video, though it's a little bit old now, is still really popular. That's generally aimed at 4 to 8 year olds, so still may be useful. We also have an A to Z of cystic fibrosis, which is quite good at explaining the basics of CF in the words of children, because they provided the A to Z for us. And as Ellie said, she's just said in the chat, siblings very welcome on our youth events. I think that has picked up all of the questions in the chat. Just having a look back. Yep, I think we've got everything. So I really hope that today has been useful and has helped you to understand more of the things that we provide to support you, but also that if there's something that you need that we don't provide, that we're very open to hearing from you, and we very much encourage you to tell us. We're here for you, and that's what we want to be. So if there's something you need that we don't do, then please do get in touch with us. One of the things that we're going to try and do, which we've not done before, is a poll. So Nicola is going to try and share a poll that asks you whether, on a scale of 1 to 10, so 10 is the highest, how much would you say your knowledge of information and support the Cystic Fibrosis Trust provides has increased during the event? So if you'd be kind enough to take a number and press submit, that's obviously really useful for us to understand how effective this event has been. We'll also be sending you a more detailed feedback form in the next few days, and we'd be really, really grateful if you could fill that in for us, because that sort of data is really critical for us in if we need to apply for funding. We always, as I've said, we always have to evidence the difference that the work we do make, and also we need to know if we're not effective so that we can do things differently next time. So please do fill that in when we send it to you. We're hugely grateful for that sort of feedback. The footage from today will be available to watch on our YouTube channel. Usually around a week after the event, we get it uploaded on there. So if there's anything that you missed or anything you want to watch again, then please do watch that. And if there's any questions that you have, if anything that we haven't picked up on today that you think of in the next few days, some of the email addresses were shared today, but also you have the helpline contact details. You can always email us on the helpline, and we will certainly do our best to provide the information you need. So if there's no further questions, I think we'll wrap up there. Thank you so much for taking time out of your Saturday mornings to join us. I really hope that it's been a useful session for you, and I hope to see you again at one of these sessions, and wish you all a good rest of weekend, doing whatever you are doing in lockdown, and stay safe and well, and keep in touch with us. Anything you need, we're here if we can be. Thank you.